Hello, my name is Christian Achaleke, and it's a sad moment for us. It's the period of COVID-19. But interestingly, I want to tell you a story how in a country like Cameroon, where there is difficulty in access to healthcare and many other sanitary services, young people were able to mobilize themselves to fight COVID-19. I am leading an organization called LOYOC COVID-19 Cameroon. And when the pandemic broke out, everyone was afraid. We were all scared. People were dying, and young people were all afraid. And many of them thought, since there were rumors that they can die, what should they do? But I instead thought of mobilizing them, making them champions against COVID. Then within my organization, I came up with an idea, the Operation One Person, One Hand Sanitizer. I realized that the prices of preventive equipment skyrocketed. There was a lot of fake in the market, and people were even more worried. There were no access to pipe-borne water to wash hands. Then I thought of mobilizing my peers, young people, for us to start this campaign, where with little or no resources, I told my colleagues we had to start producing hand sanitizers to give for free. And they asked me, Christian, who are we going to get the money to do this? And I told them it's not just about money, but it's about the commitment. We believe we can do it. Then we started. It was crazy because we were peace builders. None of us were in the medical field. But I told myself, we need to mobilize. Youth is strength. Then we mobilized young people from biomedical field and others, and we came together. While people were closing their offices, we rather transformed our peace building office into a laboratory, and we started producing hand sanitizer. With no funding, we used our pocket money and resources we mobilized from our office to start this production, from 1 to 2 to 3 to 4 to 5, and before we realized we're at hundreds. And later the government called us and said, we see what you're doing and kudos. And this was done through a press conference. Though no funding was given to us, but we continued. And before we could know, we had produced 100,000 bottles of this sanitizer and distributed across the national territory. This was shocking to us because from producing sanitizer, we brought up other ideas. We started working with inmates to produce masks to share within prisons and train inmates on how to produce theirs and also sensitize their peers. We had to engage in mass sensitization to fight hate speech and misinformation about the pandemic, developing sensitization messages in different dialects and working from communities to community. Then later, the mental health component of it hit us. Then we decided as a group of young people to set up a call center where we spoke to people who had challenges of different sort. These are all crazy because usually we feel we need funding to get work done. But my message from all of this is that we need commitment, we need to work together, and we can make change happen. And for months and months and months, we kept on doing what we were doing. And before we could know it, young people were not just seen as sideliners, but were seen at the forefront of the fight against COVID. And before we could know it, hundreds of thousands of people received support, and we have mobilized over 3,000 young people to be able to lead this campaign. This is the power of our fight against COVID as young people in Cameroon.